Does a breathing problem occur during early pregnancy?
Yes. A mild change in breathing can start in early pregnancy. Rising progesterone and higher oxygen needs make you breathe a bit deeper and sometimes feel winded. That's usually normal if it's mild and not interfering with rest. But sudden, severe, or worsening shortness of breath, chest pain, coughing blood, fainting, or blue lips are not normal. Seek urgent care for any of those. When in doubt, call your provider.
If you enjoyed this video, please subscribe.